that. And I'll be going through the main ones which are there in the syllabus. We have many different types apart from the syllabus, which we can discuss later on if time is there, or else in a concluding session or in a different session where we discuss about again the Svedana procedures. We'll go through that. So we'll go. Why the Svedana is very important? Because it is, I told you, Vada Kabahara is mainly the Svedana procedures, and mostly the diseases which we get will be Vada Vyadhi, which there will be a Kaba Nibandham. So the Svedana procedures are very, very common. If you take the whole list of Svedana procedures and Panchakarma procedures in a hospital, the Panchakarma procedures will be mainly less, or maybe compared to the Svedana procedures, it will be less. So if there is some example, if there is 8 procedures a day, 5 of them will be mainly a Svedana procedure. Okay, so that is the importance of this. So today we'll be going through these syllabus points, the detailed utility of the following Svedana procedures, which is the Shankara Pinda Sveda, which is Ruksha and Snigdha variety. We'll be dealing with Patra Pinda Sveda, Jambira Pinda Sveda, Valuka Sveda, Churna Pinda Sveda, Kukkudanda Pinda Sveda, Shastika Shali Pinda Sveda, Kshira Dhumam, Dhanyamladharam, Pilchil, Annalebam, and also the local bastis. I think it has come in the Bahis Nehana also. We'll be studying the procedure today, how to perform Januvasti, Urovasti, Grivavasti, and so on. Okay. So Shankara Svedam. Now, telling about the importance of this procedure, I have seen questions being asked in question paper about a single procedure for 5 marks. Okay, they can ask for 10 marks also. Like they can talk about the different modalities of Svedana, what is Svedana, the different types of Svedana, and explain one among the procedure, like Patrapinda Sveda. Such a way they can ask for 10 marks. Or else also they are asking a single procedure like Shastika Shali Pinda Sveda for 5 marks. In that, if you don't know the procedures, you will know how to do, but the thing is that you will not know the measurements of the procedure, how much to take, how to cook, and how to prepare, and all that. So that is the crux of this Pinda Svedas. So because when you understand the Svedas, you will understand how many positions are there, how to do all that, you will be able to understand. But the main thing is the quantity and the preparation of the material, how to do that. So I request the all students what to do is that keep a separate notebook, a small notebook, wherein you can put on the details of this materials required and just the measurements, so that only that you need to study the day before the exam. Okay, the rest of it will follow, because you'll go through the procedure how it is done, and then you'll remember and you'll write the rest of it. But the measurements you might miss out, so only that you need to study the previous day, I feel. So we'll go to the Shankara Sveda. This is mentioned by Charaka as one among the 13 types of Sakni Sveda. And that again, he has told there that it is Ruksha and that is Snigdha. So today we'll be talking what among this Ruksha is being done and how Snigdha is done, all that we'll understand. So just a brief recap of what it is told in Charaka. Is one among the Sweda procedures. Shankara is a customary name, okay, and Shankara is a bolus, that is medicines tied in cloth and made into a bolus. It is also called as Pinda Svedas. So there are a variety of Pinda Svedas, like we have Jambira Pinda Sveda, we have Patra Pinda Sveda, Busa Pinda Sveda, Kukkudanda Pinda Sveda. Anything which is covered, any material or any medicine which is made, brain prepared, and according to the condition is made into a bolus form and is used for the Sveda procedure, the name follows that Pinda Sveda. Okay, that is. And also in Sharmadhara Samhita Shankara, it is called Shankara Sveda, a mixture of medicine. Such Vyakhyan also is being told. So there he has told that it can be either tied in a cloth to form a bolus, or the bolus is directly taken. Now, how do you quote that example? I'll tell you. There is a procedure called Shastika Shali Pinda Svedam, which is called as Nyavarakidi in Malayalam, and where Shastika Shali is cooked in the kashaya along with milk. The kashayam can vary according to the condition. Commonly, Balamula is taken, and it is cooked and it is taken into a potali and it is done as Sveda. So it is covered in a cloth. The same thing we prepare into a payasa form. It means in a gruel form, and that can the cooked rice is pasted and done as an annaleba, wherein the paste is taken in hand and massaged over the body. Okay, so there it is done avastrandirida and vastrandirida. When it is vastrandirida, you get the shastika shali pinda svedam. When it is avastrandirida, it is called as annalevam. The two procedures we'll be studying today. Okay, and tolerable temperatures are maintained. You are either dipped in hot or warm liquids according to the condition. It will vary. Okay, and at the end you might rub the material also. That is all. It is not same for everybody. It is different for different conditions. Okay. So this Shankara Svedam itself, how did the Kerala Vaidyas, like we have very little references. What are the references? Charaka says Ruksha Sveda is there, Snigdha Sveda is there. There again, he has not mentioned how to prepare, how to do it, all that is not mentioned. All that was developed by Kerala Vaidyas, or the traditional methods, and different procedures were formed, and according to different materials, different types were done according to the condition. In that itself, they mainly we have this classification where it is Ruksha and Snigdha, and the in between one which is called as the Ruksha Snigdha. So let us first understand the categories. Like we have these Svedas today we'll be studying. We have to understand which category it is following, that is falling into, whether it is a Ruksha Sveda or whether it is a Snigdha Sveda, whether it is a Ruksha Snigdha Sveda. There again, in Ruksha Snigdha variety, the two type, the combination variety, according to the grade of the Ruksha, it can be Ruksha Snigdha or Snigdha Ruksha. If the Snigdha is more, it is Snigdha Ruksha, and if the Rukshada is more, it is Ruksha Snigdha. Okay, so that is how it goes. And when it is Ruksha, this is from the classics. It can be Loha, Pinda, Pamsu, Baluga, Prani, Purisha, all that can be used. And where do you perform this Ruksha Svedas? It is in Kaba Pradhana Rogas, or whereas Amavastha condition, Ama Janya Rogas or Medo Roga, and mainly Amavada condition. Any Roga which is having a Kabhanubandha, to remove that Kabha from the Samprapti, we can perform a Ruksha Svedam. Okay, and also in Ama conditions, we can perform typical Ruksha Svedam. When it is an Alpa Kabhanubandhi condition, we can perform the Ruksha Snigdha Svedam or Snigdha Ruksha Svedam, the combination varieties. We'll talk about the examples of that later on. Okay, and when it is purely Kevalavada conditions, like Shastika Pinda Sveda, Analeba can be performed, where it is Kevalavada. And that is how you place these treatments. So we have Valuga Svedam, we have Churna Pinda Svedam, we have Shastikam. How do you decide a patient is coming to you? How do you decide which is to be done first? It is based on the condition of the doshas. If it is a Kabhanubandha Vada Roga, for addressing the Kapha, we'll start with Ruksha first. And what happens when the Kabhanubandha is removed, it becomes Alpa Kabhanubandha. And if it is Alpa Kabhanubandha, the chances of Vada aggravating because of the Rukshada is more. So it is a Ruksha Snigdha we perform, because we have to reduce the Kapha and take care of the Vada also from not increasing. Okay. Then when it is Kevala Vadika, we can move on to the Snigdha varieties. So that is how we place the treatment, the Sveda procedures. I hope you understand. The types I have already mentioned in the previous class also, in that the Shankara Sveda we have detailedly understood Vastrandirida and Avastrandirida Pinda Svedas. Now these are the contents, how the boluses is made. If it is it can be sandstone, dry dungs, and all that. And we can use if according to the variety of animals available around. Goat, the dung of the goat is being used. The cow dung is being powdered, as it is made in the bhasma is produced from that, and that is being used in Shankara Svedas. So all these are in practice. It is not that it is not in practice, it is in practice. The dung of the animals, according to the availability, is being used for the Rukshana purposes. It belongs to the Rukshana category. It will never be Snigdha, okay? And accordingly, the liquid is also selected wherein we can dip and do the procedure. Okay. This is a reference of this Shankara Sveda from Ashtanga Sangraham. I've told it in the last class also. I'm just rushing through that. So Now, let us see a modification of this. We have, we'll study Churna Pinda Sweda today. And there is again a modification of Churna Pinda Swedam. This is not in the syllabus. It is just for your information that I've added this. It is called as Kadikiri. Okay. And it is a type of Churna Pinda Swedam. Churna Pinda Sweda is where you take the Churna. It can be different types of Churna. Jadamaya, the Kotam Chukka, the Kolakulatha, the variety of Churnas are there. You can select according to the condition, and then you put it into a bolus form, and then you perform. That is the Churna Pinda Sweda. There again, there is a modification where, to understand how they dip and do, I need to explain this. This is called as Kadigiri. There is the modified Churna Pinda Sweda where it is dipped in Dhanyamla. Kadi is Dhanyamla, and it is performed over the body. It is a type of Shankara Sweda commonly used in practice. It is a Ruksha Sweda mainly. The materials are, you need dhanyamlam 2 liters, you need the churna. It can be any churna. I have just put kolakulata the churnam. 500 grams of the churna you need. It needs to be prepared daily because we are dipping this and we are performing it. And at the end of the treatment, what happens? The entire churna will be, and the material will be on the body. So you will not have any bolus for the next day. So it is every day you prepare a new fresh ones. Okay. And cloth, with this, there is a general performer. You can tell the cloth is always 45 to 45 centimeters cloth, and we take the muslin kora, muslin tuni, the cotton, which is through which the materials, the heat can be transferred. But in some conditions like the Shastika Pinda Sweda and this treatment procedure, we take ones which is having the thread is wider so that the material can come out to the body also. So such materials is chosen. Okay, the bathrobe, no, the bathing, we use a cloth for bathing after to wipe after bathing. That cloth, if you take out the thread, it will be a little more wider, net like. So with that you can perform this. Thread you need 4 according to the boluses to be prepared, vessels and towels, etc. Now how do you prepare is that you take this 500 grams of powder in a vessel, and then you pour 1.5 liters of dhanyamlam. Okay, and then you make it into a paste, and you keep it in the stove, and then you mix it, and a paste like form is formed, and then you make it into 4 potteries. So this is boiled dhanyamlam, and the churnam is boiled in the stove, and then it is made into pottery form. And then the rest of the dhanyam, you will have half-liter dhanyamlam left, or sometimes 1 liter extra beating, and that is all boiled again and or heated again. The boiled form is dipped, this pottery is dipped and then again rubbed on the body. That is how it is done. So I will be mentioning about the general procedure, like how to arrange the patient and how to apply the Rasana Churna, all that in the coming slides. So we are just skipping from this, the preparation of the patient. And in this Prathana Karma, so you're dipping this pottery in Dhanyamla and then you're rubbing on the body. Okay, that is how you are pressing it on the body, and that is how this procedure is done. And the temperature is 40 to 45 degrees Celsius. So this is just a rough process. It is not in the syllabus, but this is a common variety of Shankara Sweda performed, wherein the powder, this is the churna. The churna is made into a pottery or a bolus form and just dipped in the kadi or the dhanyamla and being performed. And at the end of the procedure, the medicine is taken off the body, and with the coconut leaves, because it sticks to the body, it comes out as a paste form. And then we take it off with the coconut leaves, or we can use a similar devices where you can take off the paste from the body, and the body is wiped. And then you take off the thalam, which is kept initially, and flesh thalam is maintained. And the patient is taken into rest for half an hour, and then taking a warm water shower. There are the common complications is synchronization issues, and then if you don't perform it in a very speedy manner, the patient can shiver in between because an aggravation of symptoms can happen. This is regarding a table regarding when you can perform this. 7 to 11 a.m. you can perform. Avoid the pitta time or the peak time, noon time, and then you can begin from 3 to 6 p.m. Now the duration is 45 minutes or till the dhanyamlam you have taken is which for dipping is over. That is how, or the boluses will be empty because the whatever it is there in the bolus, it comes out through the sieve like a cloth, and it comes to the body, and the body will be fully pasted with this kadi, this dhanyamla and churna mixture. Okay, then you wipe it off. That is how we perform. Temperature is so. Heating modality is the steam coming out of the procedure. You get a very nice steam coming out of that. It is forced conduction, kabavada shamanam, and deep and exciting nature. It is very intense type of Ruksha Svedam compared to the simple Churna Pinda Sveda. This will be intense. Why? Because this Churna is being mixed with Dhanyamla, which is more Tikshna and Ushna, and more it can penetrate deeply because of the Amla Swabhava of the Dhanyamla. Indication is Vadavyadi with Kaphanubandha, Sleshma Medo Vigara, painful conditions, and also in Grandhi, we can perform this. So mainly it is Kaphavada, where Kapha is more, not Alpa Kapha, more Kapha is there, or Amavasta. Paitika conditions and Kevala Vadika diseases, we don't do this procedure. Okay. So Bibu, I hope you know what is Dhanyamlam, right? Aishwarya, you know what is Dhanyamlam? Dhanyamlam is a fermented liquid by Santana procedure we perform with grains. Okay, with lots of grains, we keep it for fermentation, and then we take it after 7 days. I'll be giving you a note how the Dhanyamla is being prepared in our hospital or in
Hello?
any other place. Hello.
Hello. Listen,
Do,
the
do you know what is Dhanyamlam?
no.
Okay. I'll explain to you in detail in the note, in a note which will be given to you. Okay. So there we
Okay.
take a lot of grains like, yeah, you take kulatha, then methika, the laja, all that is taken, and then you keep it as boluses in a big container, big container, and keep it for 7 days for boiling. And the 8th day onwards, you can take out the liquid which is coming. It will be a very fermented liquid. Okay, and that is the dhanyamla, which we commonly call as kadi also in Kerala. All right. So I'll give you in the note how the anyamla is being prepared. So next we'll go to the Churna Pinda Svedam. So we are going through the one by one syllabus points. So this can be asked as a single question. Explain Churna Pinda Sveda, how the procedure and how to perform it. It can be asked. So Churna Pinda Sveda, as the name tells, it is a Pinda Sveda. It is a bolus variety of Sveda where Churna is being used inside. The Churna is a material for imparting the heat. Okay, so depending upon the quality of the churna, the condition in which you apply it will be different. If you are taking Kottam Chukadi churna, it is different. If you are taking Kolakulata churna, the application will be different. So according to the patient and the Roga Avastha, we will be choosing the powder differently. Okay, you can use, I'll come to the slides and then tell. So it is a Bahi Parimarjana Chikitsa. All these are Bahi Parimarjana Chikitsa. Nothing, you are not doing this internally. You are doing it externally. So these comes under Bahi Parimarjana Chikitsa. So this can be an explanation which you can give in any Sveda procedure, that it is a Behiperibanjana Chikitsa. And it will be a Sagni Sveda, because Anagniya Sveda is all we have discussed earlier, the 10 varieties told by Charaka. So all these which we are discussing today is Sagni varieties of Sveda, where they are in contact with the Agni. Okay. And it is one among the Ushma Svedas, just Churna Pinda Sveda. Vakpada and Sustruda has told. And Charaka has told it as a Shankara Sveda. That is, it is covered in the bolus form. The Pinda Svedas is coming under Charaka's variety. Okay. The word, what do you mean by Pinda? It means boluses. So Pinda Sveda refers to the sudation, which is sweating procedure, which is performed by the boluses of the drugs. It can be Ruksha or Snigdha, as I told. I'll tell you how it turns to be Snigdha also. And according to the type of drugs used. There are various types of Pinda Svedas. Okay, and Churna Pinda Sveda is one among them. Like we have Alika Sveda, Patra Pinda Sveda, Jambira Sveda, etc. Now, Churnapinda Sweda is one of the Ushma Sweda I have told already. It is done with various churnas. So what are the different churnas? I'll tell you. Kottam Chuka, the churnam is there, which is used in intense deep conditions where it is more ruksha in nature. Whereas Kola Kulatha, the churnam is more little snigdha because we have little seeds, other sea bijam, all is there. So it is more little snigdha, but not that snigdha, it is little snigdha, that's all. So we can change the content of the pottery according to the condition of the patient. Okay, and it can be done as snigdha and ruksha according to the condition. Now, how do you turn this churna? This churna pindasveda is simply churna fried and tied into a pottery. How can you turn it into a snigdha variety? When you apply oil on the patient and then do this pottery, it turns to a snigdha nature. Or we can heat this churna in a oil pan and then tie into a bolus. So two types you can do and make it into a snigdha form, depending upon the anubandha dosha. If it is alpa anubandha and you think if snigdha can be more, you can fry this churna in Eranda Taila or Nimba Taila extra, and then you can put it into a bolus and do with that. Or else you can, if you need a ruksha, you can take the powder, you can fry it and tie it into a bolus and can be used as ruksha itself. You need alpa snigdhada, you can tie the bolus, apply oil or do an abhyanga first and then perform. So it will only little snigdhada will be there. Aishwarya, am I clear what I am telling? How to
Yes,
turn this?
ma'am. Yes, ma'am.
Okay, okay. So this can be made into a further intense variety. So you have various combinations. If you need to do it in like what I told, like kadikiri, where you are dipping the churnapindasvedam in a liquid, right? Can be dhanyamla. If you think the Trifala Kashaya or Guluchadi Kashaya or Punarnavadi Kashaya, okay? In Kerala we call it as Mukkikiri, okay? Where this Churnapindasveda is dipped in a Kashaya and then performed to increase the Rukshada, or it can be in takra, coconut milk, all according to the condition or the yukti of the physician. We can administer in a patient. Okay, so in our hospital we do perform dipping it in Punanavadi Kashayam. If there is shofa and you think Potli Sweda is good, and then you can dip in Punanavadi Kashaya and then we perform. Guluchadi Kashaya is taken. Okay, so Trufala Kashayam is taken. So we can modify it thereby, and sometimes dipped in dhanyamla, as I told in kadikiri. So all these are being employed. How do you take the materials required for the ruksha variety and the snigdha variety? So this is very important. This slide is very important. The procedure you will understand today and you will not forget, I'm sure. But how to, what is the quantity of the churna you require, you will forget. Okay, so suitable churna is 1.5 kilogram in ruksha variety. Okay, and snigdha also you need the same kind of 1.5 kilogram is needed. And this kiri, this pottery which you are making, it will change 3 times. Okay, so the first day, then you'll change it in the fourth day, and then you can also sometimes every 2 days also we change, or sometimes according to the patient we can change. Okay, according to their wealthy, if they're able to change it at least 2 days, we can do it like that. So in our hospital what we do is we change it the third day. That is one day we take, first day and second day we do, and third day we change it, third day and fourth day they do, and fifth day they change it, fifth day, sixth day, seventh day they do. So that is how it is done. So 1.5 kilogram is needed because 500 grams for this changing each the alternate days after every 2 days. Then Rasnadi Churnam is for putting the thalam. Cotton pieces, as I told, that is the standard one. We'll make 4 pottlies. If you need 2 pottlies, the combination will be reduced. Okay, the quantity will be reduced. 4 pieces will be mostly 45 centimeter in 45 centimeter. That is the common length we take, the measurement which we take. Tags for tying, vessels for heating, towels for rubbing and cleaning and all that. Massiers, we need 2 of them. Okay, and attendants also, one is enough, or two if there is availability, two can attend to the procedure. Because mostly we start the procedure with one attendant, it's fine. There is 2 massiers will be performing, and one will be reheating the pottery. For when it is when the heat is gone from the pottery, they give it to the attendant, they heat it again and then give back. Okay, so when you have 4 pottlies, with 2 pottlies the therapist will be performing. The two will be given to the attendant to heat, so that when you hand over this pottery, that the other one which is heated will be hand over. Okay. So to make it snigdha, how do you, what all you need? We need for frying. If you're making it pakka snigdha, you need oil for frying. That will be 100 ml. Heating the pottle. If you're again frying it and then heating and dipping it in oil, you need 250 ml. If it is just mere application of oil and then you're performing 100 ml, it's enough for abhyangam. If you're putting a talam with oil, you need 10 ml for that also. So there again, I'll just give you an example. The talam can vary. If it is a ruksha pinda swedam where there is no oil, mostly we give rasnadi as a talam. Because why do you put talam in these conditions? I hope talam is mentioned in, there is a topic which will be coming. I think this over and snehana, where talam, what is the importance of talam is all mentioned because it is a svedana procedure. So when if it, in order that the ushma, the sweda is entering and then causing a kleda inside, we prevent that and to get the chances of getting cold and all that, we to prevent that we are putting the talam in the sweda procedure. So depending on the procedure, whether it is rukshada, we'll perform a ruksha talam with rasnadi churna alone. Sometimes we perform with rasna jambiram, that is lemon juice with rasnadi mixed and heated, and then you make when the warmth is gone, we put it in the bregma region. That is a rasna jambira talam. If it is a snigdha procedure like patrapinda sweda or jambira pinda sweda, where which is oil is there, then we can prepare the talam with another oil mixed with rasnadi. The common ones are nimbamradadi, eranda tailam mixed with rasnadi. We can put it as talam. Okay. Then we have kachura, the shirabala can be taken if there is a BP fluctuation and all that. So, okay. So depending upon the condition of the patient, we can vary the talam accordingly. The pura karma is how do you prepare this potli? So you got the measurements. Now that powder, for if you're preparing it today, you take 500 grams of powder, you will fry this. Okay, because there will be little of moisture in the powder which is there in the packet. In order to remove that, you just fry it no need to fry it so much, just a little bit frying till it becomes little crispy and golden brown in color, and not very brown because already the churna will be brown, little brown color. Then you stop it and then you divide it equally into 4 parts and you tie the pottery, and then the patient will be seated in the droni with legs extended. Okay, and then the rasnadi churnam, the thalam, whichever is mentioned according to the condition, will be applied, and then we'll do the procedure. So if it is snigdha variety, what we do, we will take this powder, fry it appropriately in the quantity of oil mentioned. And if it is abhyanga is required, the patient is asked to sit on the droni, and then abhyangam is performed initially for 15 minutes, and then first talam is applied and then the abhyangam is done. Okay, every time before starting with the procedures, we do the talam. Now, pradhana karma. So any procedure you are going to write. So whether it is churna pinda sweda, whether it is patra pinda sweda, whether it is a jambira pinda sweda, what will be the headings? I'll tell you. First, any topic. What is the introduction of that? If it is churna pinda sweda, you'll be telling that it is a pinda sweda performed with churna, and the varieties of churna you can mention. Okay, single herbs can be taken, like single herbs like methika, shatapushpa, okay, kulatha, all this can be used, or combination drugs like kola kultadi chuna, janamayadi, kotanchukadi, etc. can be taken. Okay, for the pindasveda. Then you will be telling it is a bahi parimarjana chikitsa. That will be the introduction. Then you will write about the materials required. Then you will write the pura karma, the pradhana karma, the paschat karma, and then if there is any complications and if, how do you manage it, and then how you'll talk about the precautions of it. So this will be the format of any procedure. All right. So the headings is a must. It should be there in the paper. The headings, these many headings should be there in the paper. The introduction, the materials required, the pura karma, pradhana karma, the paschat karma. Pura karma will include what is the preparation of the patient and what will be the preparation of the medicine. All right. And then pradhana karma. Pradhana karma will be definitely you have to write about the 7 positions. We do these procedures in 7 positions. That should be written in that. Okay. And then the paschat karma, what to do after, which is very common for most of the procedures except 1 or 2. And then what are the precautions for the procedure? and what is the complications, if any, how do you address it. This is the main things you have to write. Okay, so in this, what is the pradhana karma? You are taking the potali, and it should be after heating, it should be gently applied off on the body after checking the temperature. Very must in every sweda procedures. Okay, no matter which sweda, you are applying the heat on the patient, and it is a mandatory procedure that you check the temperature on the back of your hand. Okay, if it is a drava sweda, you'll pour that liquid. If it is a potali sweda, you will hit and see the temperature, and then only apply it on the body of the patient, because you cannot make a mistake of burning the patient, or giving a chance of burns to the patient. So it is a mandatory procedure to check the temperature before applying. So that is one very important point. Okay, and there are different types of swedas, right? With some swedas we just hit like this. Okay, with some we hit and then we rub, and some we only rub. Okay, so in this churna pinda sweda, we don't rub with it, we only hit with it. So it is a hitting type of sweda. So that is why just pressing or hitting with the botli should be done. You will not do this kneading massages with the churnapinda swedas. Okay, and when the heat is over, you will alternate, and you'll maintain the temperature uniformly. So it cannot be like there is the heat is there in the potli, the heat is lost again, with that you're tapping. No, once the heat is over, you check in between and see if this temperature is okay. If the temperature is less, change the potli. Okay, and then take the fresh potli from the attendant, and then maintain the temperature uniformly. The synchronization is important, maintaining the temperature is also very important, and it should be done for 30 to 45 minutes in 7 positions. In any sweda procedure, it will be done in 7 positions. We'll study the 7 positions, and this is common for all the Svedana procedure except for the local Januvasti, Grivavasti, all that. For rest of it, everything, the 7 positions is a must. I'll tell you what are the 7 procedures in the coming months. Okay, you can write that here also. It is common for everywhere. Paschat karma is what, after the procedure is over, you'll remove the talam first, then you will wipe off the patient, you'll apply fresh talam. Okay, that will be simply rasnadi, whether it is oil talam, etc. That will be the initial talam. After which the procedure, after the procedure, you'll remove whatever talam is there, and you keep fresh rasnadi churna. And then I told you in the Sweda procedure, right? They have to rest for half an hour. Why? Because the Svedana will cause a blood circulation and heat in the body, rise in body temperature. That must come down to the normal temperature. So they go to their bed, they lie down there covered without fan or anything in their room. They lie down there for half an hour, let the temperature come back, and then they can take a hot shower, or a shower in hot water bath. And is you can they take a head bath? That's another doubt, right? Can they take a head bath? If it is recommended by the doctor that if there is no problem, you can take a head bath, they can do. Or else in some conditions, to, because some patients will tell, if I take a head bath, I might get a cold or fever the next day. In that conditions, we avoid it, because the procedure will be stopped if they get a cold or fever. Okay, so to in order to not to, the procedure from not getting stopped or getting cancelled, we tell them if it is okay to just rub their head and not wash their head daily. Okay, every third day or after the complete procedure, 7 days, they can take a head shower. That is also being recommended. Indications is Vada Kabaja Vigara, Sandigata Vada, Gridrasi, Amavada. Also, the CPS Ruksha is indicated. Precautions, what are the precautions while you are frying the churna? Don't get it burnt off. Charring, prevent charring. And if the patient feels any discomfort, right? What they might get a little bit tired or dizziness, then stop the procedure, and the procedure should be stopped, and we can attend that. Okay, ideal time I have already mentioned. Complications mostly common are the fainting and rashes. If there is fainting, stop the procedure, and then it can be due to the increased temperature. If you are performing the Svedana procedure in a very high temperature, this fainting can cause. Okay, so that can be stopped, and then you can give them some water to drink, and then make them okay. Check their BP and vitals, all that can be checked, and then you can start or postpone the treatment for the next day. If there is any rashes or any burns, you can apply Grida, Madhu, Shadadauda Grida, all that can be applied. Whatever burn management we can do. These are the different types of Drukshapinda Svedas. Valuga Sveda we'll be studying in detail. Another one is Ishtiga Churnapinda Sweda, where the brick powder is used and it is used in Vada Kantaka. So the procedure will be saying you heat in the boluses and then you keep it in the area, the Vada Kantaka area. Then another is Busa Pinda Sweda. These are not asked for exams. Okay, this is not there in the syllabus. These are extra points. So Busa Pinda Sweda is a husk. Okay, the husk it is used mainly for the chest region. You can use it in the Vishujika conditions also. They with the it is powdered and then you can take it into a bolus form and then you can heat it and give small massages. Okay, then as I told, it can be done. You can the CPS Ruksham can be performed with single herbs also, like Methika, Kulatta, Yava, Lavana, Busa. Like you can mix Lavana Pindasvedam is being administered. Like in small areas like tendinitis and all that, we prepare small boluses with Lavana. Okay, and then they can heat it and then apply it. So such varieties of Svedas are also being done. Before that, if you want to apply oil, you can do that also. These are some of the examples of different combinations which can be used in Grihadumadi and Churna can be used in Sarvanga Gada. We can take the oil Sahajradi Thailam. It can be dipped and done. In Pakshagada, these are all indicated ones. Okay, Bushapinda Swedam and Levanapinda Swedam is being indicated. Ardhida Kolakulata Dijunam plus Busa plus Levanapinda Swedam. All this can be done. In Uristamba, it is purely Ruksha which we perform. So you can do Lavana Pindasveda, Busha Pindasveda, or a Churna Pindasveda can be also done. Pruduka with the larger, flattened larger, right? That with that you can do in Amavada condition. We perform this Pruduga Pindasvedam. Karisha Pindasvedam is it is good for obesity. We have done that thesis in our college. It is good for obesity. Pakshagadam, Apadanagam. In the initial Kabanubandha stage, we can perform this Karisha Pindasvedam where the cow dung is being dried and then you get the basma out of it, and with that you can perform. Okay, the basma kiri is the basma being performed and the karisha is the dung alone dried and powdered is being used. And basma kiri, it is very good combination. It's good to reduce the swelling, whether where there is edema or a generalized swelling, you can reduce using basma kiri, because generally basma has got the property of absorption. Adsorption is the term, it's not absorption, it is adsorption, because water content will be absorbed. Okay, and so in Staulia, CPS is very highly recommended with basma and kulatta churna. So this is a different varieties of tune-up industry, which you can mention that there are a lot of practices being there with the different varieties of tune-up industry. So it can be either done alone or with a combination ones also. Commonly used are Kolakulatadi, Kotanchukadi, Nalpamradi chuna can be used. Then you have combinations like Navadhanya Kiri, where the 9 dhanyas are being used. Trinadhanya Kiri is there. Yava Kolakulatadi, Yadhanya Kiri is there. These are all according to the Yukti. Mainly it is beneficial for Vadavyadis, and certain conditions demand certain, that is from the reference of the text we can take and do accordingly. And Kaphavada, soft tissue inflammations, stiffness and pain and all, it is very highly good. You can ask them to perform. What we do is, if the patient is not ready to get admitted, we can ask them to perform a kulatha. You know what is kulatha? The horse gram. It is readily available in their home, but you should know where to tell this procedure. Okay, you should understand where to apply this procedure. You can ask them to fry the horse gram, powder it little bit in the mixie, and then take it into a bolus form, heat it, and then apply it on their neck region. Commonly we give it for the neck region and all. Okay, so such they can practice at home also, small home remedies. This we have already mentioned in the Svedana, how Svedana is being highly actively being used in this treatment. Okay, because there are different varieties. Ruksha and Snigdha is there, and vasodilation, absorption rate is all involved in this procedure. Blood supply will increase, oxygenation will be increasing because the circulation is improving when the Sveda is happening. Okay, so it is a method to bring out the toxic waste out of the Srodharodham, which we call the Svedavaha Srodharodham, can be removed with this type of Sveda procedures. Shall I go to the next one, Balika Svedam? Aishwarya, shall I go to the next Svedam? So, Balika Svedam.
Okay.
Are you able to follow how to write this procedure if a question is being asked? Okay, if Churna Pinda Sweda is asked, you can write about different types of churnas, then the introduction can be given. Then you need to write about the materials, what all you require, and then you will write about the Pradhana Karma, how the Pura Karma, where you are preparing the patient and also the kiri you are preparing or the potali you are preparing. And then you will write about the Pradhana Karma, which will include the 7 positions also. I'll tell you the 7 positions. It is coming in the slide. I'll just show you and then tell you. Okay, then the Paschat Karma, the complications, and the precautions. These are the headings you need to write. Okay,
Okay.
we'll go to Valuga Seda. What is Valuga? It is the sand. Okay, older times we tell Valuka Sweda was very cost effective because sand was readily available. Now sand price has increased, so it is not that readily available. So it is little costly itself. Okay, it is so Acharya Sushruta and Ashtanga Hridaya included it under the Taba Sweda, that is heating a material and the heat is transferred. I told you then that in Taba Svedam the quality of the or the substance quality is not important. No, the material does not have any guna. Only the imparting the heat is happening there. So intense heat can be imparted through Vahalika Svedam. You use for frying the what you call the groundnut. No? For frying the groundnut, people use this the sand. Why? Because sand absorbs heat a lot. It will be very it will catch the heat very fast. Okay, so that is why sand can be used for giving a heat. So according to Charaka, it is in Ruksha Sankara Svedam, and Delhana has told it under the Shamshamaniya Svedam. So Valuga Svedam is not, this Svedana is not for before Vamana or before Virajana. That type of Svedana is not Valuga Svedam. Suppose a patient is having a back pain, suddenly he got a back pain. It is not an old back pain. It is also a sudden catch of muscles, such pain. You can tell them to take a Valuga Pinda Sweda. Okay, this is a samshamaniya. Just like you apply balm, you're getting a relief. That is how it works. It is Valuka Seda is done, and then he'll get a some temporary relief. It is not curing the disease. Okay, it is not a part of the shodhana. It is only a samshamana. The quality of heat is dry. Okay, now when you talk about Svedana, you can tell dry heat and wet heat. Okay, where you apply dry heat is different and where you apply wet heat is different. So this is only a dry heat and it is a Pakka Rukshana type of Sweda. Action is more superficial and pacifying because with the Valuka you don't give intense, you don't do it for some time because you'll burn the patient. It is just hitting. Okay, Valuka you cannot rub on the patient because they'll have scratches, they'll get scratches with the sand. So you need you'll just press it on the body. That is how Valuka is being done. So it is a modified and it is relatively deep heating technique, a type of Taba Sweda is Valuka. In this procedure, the sand is being made and it is used, the cloth, it is tied in a cloth, warmed up and then applied on the affected part. It can be whole as Eganga or Sarvanga. Okay. If only they are having pain on the neck or pain on the back, you can do it from the local area. Eganga can be done. But if it is like an Amavada, they have it on all joints and then we can do for a Sarvanga or a whole body procedure. Now, what type of sand do you use in a Svedana Karma? Okay, it should be a sand river and ideally from a flowing river. Why? Because if the river is standstill, the sand will not be having round edges. If a river is flowing with that momentum, the sand will be having round edges and so it will be also very clean. So that the flowing river sand can be used and it can be taken and then dried or then heated and then made into a pottery. That is how Valuka Sweda is being used. Okay. So ideally a flowing river sand is very good because they will not have edges very sharp. So when you're pressing and doing it, they will not produce any scratches on the body. These are the properties of Valuga. It is Mathura, Sheetham, Inverium, and Lekhanam. But these are not being uh, affecting the procedure because I told you it is these are just properties of Valuga. It is told in Basavarajyam, and you are taking this Valuga just for applying the heat. That is only we are doing. Now, how much Valuga or sand do we need? Around 500 to 1 kg sand we need. And you need 2 cotton clothes, 45 to 45 centimeters, which is common for everything. Thread for tying. And then you need a cotton. very bottom iron vessel. Okay, round bottom iron vessel should be there for heating this the valuka and then doing the procedure. Rasnadi churnam should be applied first, and towel is needed for wiping. Now, Purakarma is first you're going to collect the sand, right? Valuka Svedam, you wrote what is Valuka. It is a Shamaniya Sweda, all that you write in the introduction. In Purakarma, you're collecting and preparing the pottery and preparing the patient. Okay. So, as I told, river sand is collected, devoid of gravel and waste material, cleaned and filtered. And if necessary, you can add a small amount of salt in it because to increase the the penetration property. Okay, Taishne property, in order to improve that, you can add or the Sukshma property. It can reach the smooth, so the heat can reach further deep if you add a little bit of salt. What you do is that iron vessel is placed on the stove, and then you heat it to a temperature, then you prepare the potteries. Okay, and first the patient will be sitting on the droni with legs extended. He will be placing his legs straight and he'll be sitting on the droni. Then you apply talam on his bregma region. How do you take bregma region? You can take it like this, or you can tie a thread from this hair, the ear to ear, and from nose to back, and the meeting point will be the bregma region. Or you can take this way also. You can take the 4 plus 4, the 8 angula, you will get it correct on the bregma region. Okay, what is the pradhana karma? The patient should sit comfortably, exposing the part to be performed where it should be sedated. The hot pottery is then generally, after confirming the temperature, it is gently pressed on the body. Okay, it is gently applied on the body. No, you are not rubbing it, only pressing with the pottery. Okay, the pottery should be used after reheating to maintain the uniform temperature. It is same for almost all the procedures. Okay, 30 to 45 minutes for 7 procedures is for the whole body. If you're doing it for a ganga, only the neck, you need not do for 45 minutes. You can do for 15, 10 or 20 minutes maximum. Paschat karma, talam is removed with cotton cloth, and then rasnadi churnam should be applied. Patient should take rest for complete half an hour and then take a hot water shower. Precaution: sand should be neat and clean. Temperature must be optimal to prevent burns. And this is one important, because it is sand, there are chances that you get the cloth gets torn and it makes a hole and then the sand come out. So this, in this Valuka Svedam, we are not changing the Valuka daily. Are we going to change the Valuka daily and do the procedure? No. We are going to use this Valuka Sveda for 7 days or however much days the patient is, the doctor is saying. Okay, but every day you must be careful that the cloth is new, because there are chances that it can make a hole, and while doing the procedure, the whole sand can leak out. That must be taken care. You're not changing the dravya there, but you're changing the cloth there with which it is covered. Complications is mainly burns in the Svedana procedure, which is managed with Shadadauda Kritam or Murvana can be applied. Duration, this is for the Aganga. Okay, 15 to 20 minutes. This is for Aganga. 45 to 50 degrees Celsius is the temperature. The heat modality here is thermal. Only heat is giving. Conduction and radiation is the mode of heat transfer. It is mainly indicated for Kapha Vigara. You are not going to give it for a Vata because it is a Rukshana variety of Sweda. Superficial and not pacifying. It is only pacification is happening there. Indications is Kapha Vigara, Sama conditions. Samavada, there is reference. The Chikalsa Srutam, it tells like Ruksha Svedo Vidadavyo Valuga Portales Tada. Valuga Pudages Tada is a reference from Chakradatta. So there it is told clearly that you can indicate Valuga Sveda for an Amavada patient. Urustampa is another condition. Medu Roga, Granthi, acute phases of the diseases where there is Kapha Nibandha or Amavasta, you can give the Sveda. Contraindication, Pitta Rakta involvement and Shadaja Vigara and Kebala Vata, you are not supposed to do. Is it clear, Aishwarya? Now, the next procedures, I'll be skipping you can see this, I'll be sharing the slide with you. You can see the procedures, what I've written. But mainly, we are going to learn about what are the measurements today. Because the procedure is the same, but it is just heating and then giving, all that is same for all the common procedures. Okay, whatever differences is that, I'll speak out. This is just an introduction to the Sweda, which you can write for Patrapodla Sweda. Everywhere you can write it is a Bahiparimarjana Chikilsa, and Svedana is one among the Shadubhakramas. The Pinda is you can also write that that it means boluses, and when it is Pinda Sweda, you are performing the Sweda with the bolus. Okay. Now, what is Patra Pinda Sweda? The sudation given by bolus prepared with leaves. Patra, that is being told. And this procedure is an extension verse of the Patra Bhangena Dhanyena, which is from the Ushma Sweda. It is mentioned that Patra Bhangena Dhanyena. That Patra Bhanga means this leaf which has chopped. Okay, and then PPS is it also has got a lot of variations. Okay, in Kerala traditional test, Arogya Kalpadrumam, it's a traditional test. You get the information from that text. That is a reference of PPS or the Patra Pinda Sweda. Okay, PPS stands for Patra Pinda Sweda. Now, this is a reference of the Ushma Sweda. You see the second line, Patra Bhangena Dhanena Karisha Sigada Tushe. So that is the reference you get that these leaves can be used. With that, they have modified, and in Arogya Kalpadrumam, they have come out with what are the leaves which can be used and all that was mentioned. So, Tatra Patrabhangena, that is a reference by Arunadatta. That is Patrabhanga means Patrabhanga's Chadasamua, cluster of leaves is called as that. This is the reference of the Arogya Kalpadrumam reference, which tells what are the leaves and how you do it. Okay. It says Shigru Chinjarka Nirgundi Varana Eranda Pallavehi Anyerva Tatsame Style. Anyerva Tatsame Swinne, Styla Swinne, Sakerage. That is, what are the leaves you can take? You can take Shigru, which is the Moringa oleifera. Okay. What you call as the Moringa. Okay. Chinja is the tamarind leaf. Okay. Arka, Nirgundi is Vitex Nigundo. And then you have Varana, Eranda also,